A new program will create a youth crisis outreach team to help North Texas children. The North Texas Behavioral Health Authority just received a more than $1 million grant. Fox 4's Shaun Rabb has more on how it will work in tonight's Here and Now.
Okay, having a conversation with Jessica Martinez, the Chief Clinical Officer at NITBA, the North Texas Behavioral Health Authority. And tell me, please, ma'am, about this grant of $1.25 million from the state for a mobile youth mental health outreach?
Yes, sir. It is called the YCOT, the Youth Crisis Outreach Team, and it is a pilot program for the state of Texas for individuals, youth and children, their families that are in crisis. We have an MCOT team, so it stems from our MCOT team, which provides a 24/7, 365 days a year crisis response. But what YCOT does is specialize in youth services.
Okay, so tell me about MCOT, what that stands for.
MCOT is our mobile crisis outreach team.
Okay.
And so that serves the entire community, adults, geriatric, children, anybody who is in crisis.
Do we know just how severe the crisis is right now among our youth, our teens and adolescents?
I do know, when you're working with youth, the crisis is very severe in the sense of individuals are having more contact with law enforcement, going to emergency rooms. There's more at risk of out-of-home placement, increase in activities with juvenile justice departments. And this program will really be able to come in, work alongside those families, the youth and the children, providing that additional support, trauma-informed care approach.
What are you learning at NITBA? What are the issues? Are they systemic? Are they societal issues? What are you learning?
It's a combination of both. You've got individuals that have family systems, just the natural learning and coping and managing within the family system. Sometimes there are broken relationships, conflictual relationships, and just needing to learn coping mechanisms and skills. You've got individuals that have had increased anxiety, increased depression because of just the pandemic, as we've seen, just more, symptoms that are related to managing and coping with every day. And then again, those mental health issues that are more organic or genetic, where we're seeing a lot more of that.
What will the grant do for NITBA to carry out this pilot program?
Absolutely. So this grant will allow us to have a team, and we serve 6 counties. It will be bringing on 6 new staff with NITBA who will all specialize in children and adolescents and family systems, trauma-informed care, and really providing an outreach and education to our community that I don't think we've had before.
So it's mobile. Are you going to go to the families' homes? Are you going to the school district and meet with families there, or the juvenile system? How's it work?
With this being mobile, we're going to be responding to the family, the child, the system. So wherever that child is, it can be in home, it can be at the juvenile justice department, it can be in a detention center, it can be at the school district, it can be in a CPS office, it can be on the side of the road. It really is intended to meet the family where they're at, providing those crisis intervention skills long-term. So this program will allow us to work with a family up to 90 days, but really the goal, or the minimum goal, is 4 to 6 weeks.
So how can folks find out more about this program, as well as what else NITBA might offer that could help a family?
Absolutely. It's a state-designated crisis line. And so our number is 866-260-8000. That number will allow you to connect to one of our specialists who will triage a call and will determine if there's an MCOT response or a YCOT response. That is how all of our calls will be handled and funneled. But just regarding program and other services that NITBA has, we have a website. It's www.ntbha.org.
I'm really excited about what this can do to help some families, to help some young people, and maybe turn some lives around.
We are really excited, and we're hoping that this intervention will also decrease the need for law enforcement interventions, emergency room visits, and allowing individuals to get the care at home where it's needed.
All right, thank you both. That crisis hotline for the North Texas Behavioral Authority it's right there on your screen. It's 866 888-260-8000. And the website for the Mental Health Authority is ntbha.org.